Medical Devices, Infusion Pump, Lesson 1, The Purpose and Principle of Infusion Pump. This unit covers the basics of medical devices. The goal for this lesson is to understand the purpose and principle of an infusion pump. This is the content of this lesson. An infusion pump is a device that infuses medication into a patient by squeezing the dedicated infusion line. One of the features of the infusion pumps is that the infusion through the pump is less affected by the height of the fluid container and viscous resistance of a tube, compared to natural dripping. In addition, the flow rate error is plus or minus 10%, and the minimum set flow rate can be set from 1 milliliter per hour. Now we will explain when the infusion pump should be used. Firstly, the infusion pump is used when the infusion flow rate needs to be strictly controlled, such as for chemotherapy, vasopressor or antihypertensive drugs, and total parenteral nutrition, so-called TPN. Secondly, when there is a critical need of strictly controlling the infusion fluid balance for patients in ICU, patients with cardiovascular disease, elderly, infants, and so forth. The conditions of those patients are at risk of rapid deterioration. Lastly, the infusion pump is used in situations where natural installation is difficult, in which the dripping rate changes depending on the patient's position and other factors. Next, let's look at how the infusion pump manages the infusion flow rate. There are two types of infusion pumps, drop-controlled and volume-controlled. The drop-controlled infusion uses a drop sensor to count the number of drops to control the infusion. One of the advantages of the drop-controlled infusion is that general-purpose infusion sets can also be used since the drop counting is not done by squeezing the tube. On the contrary, there is a disadvantage that errors are likely to occur due to differences in the size of a single drop because of the drug viscosity. On the other hand, the volume-controlled infusion controls the infusion flow rate by peristaltic motion of the finger pump in the main unit. The volume control system has disadvantages that only dedicated infusion sets can be used because the tube diameter is critical for infusion, and the tube must be replaced periodically. However, it has less error in flow rate because it does not depend on the viscosity of the drug, and is widely used. This is the end of Lesson 1, The Purpose and Principle of Infusion Pump. Make sure you've mastered the basic concepts before you move on to the next level.